it's not just a job that you get hired for as an entrepreneur. There has to be a driving force. And that brings me to, your mission. And what is it that really inspired you to go into this specific area? I know it started with sterile processing. Was there a catalyst, or did you just see the need there? Why that area for Beyond Clean?
Yeah, I mean, specifically for sterile processing, it's just a very unrecognized, unknown function in the hospital, and specifically surgical services. I don't think the general public has a real good understanding, or even probably don't even know that this department exists. What's interesting is a lot of the technicians that work in these departments are, working below the poverty line in terms of wage and pay scale, and yet their jobs are highly technical, involve a high degree of stress. Most of the jobs, most of the departments, and this has been changing since the advent of the Accountable Care Act, but many departments have really lacked, the kinds of funding, even for just equipment and technology to reduce human error. And yet they're the ones that are taking instruments that a lot of people think there's brand new instruments going into the OR every time. They don't realize that those instruments, if there's, 6 of those orthopedic cases that day, maybe one of those sets comes back down, gets cleaned, gets disinfected, gets reassembled, gets sterilized, and then gets put on the shelf to go back up into another surgery. And so,
You hope it
inspecting
was
those
done right,
instruments,
right? I mean,
right.